Does aging necessarily cause pain? Challenging misconceptions in clinical practice. The relationship between pain and aging is complex and multifaceted, with substantial scientific evidence indicating that pain, particularly chronic pain, becomes more prevalent and impactful with advancing age. However, it is crucial to understand that pain is not an inevitable or normal part of aging, but rather a consequence of underlying conditions and age-related physiological changes that are more common in older adults. Furthermore, not all pain experienced by older individuals signals a serious medical condition that requires immediate extensive investigation or complex medical intervention. Healthcare professionals must provide clear, evidence-based information to challenge these ageist beliefs, differentiating between common, manageable pain and red flag symptoms. What is the scientific evidence regarding aging and pain? A recent systematic review strongly supports the finding that chronic pain is highly prevalent in the general adult population, with socio-demographic factors, including higher age, consistently identified as being associated with its presence. In Europe, pain prevalence ranges from 12% to 48%, with the highest rates among those aged 65 and over. In older adults, common sites of troublesome pain include the lower back, neck, hip, knee, and shoulder. This increased prevalence is attributed to several interconnected factors. 1. Higher incidence of painful conditions. Older adults are more prone to developing conditions that cause pain, such as musculoskeletal disorders like osteoarthritis or osteoporosis, neuropathic pain like diabetic neuropathy, and pain from cancer. 2. Physiological changes with aging. The aging process itself alters how the body processes nociceptive signals. This includes changes in both the peripheral nervous system, for example, nerve degeneration or altered ion channels, and the central nervous system, for example, impaired pain-inhibiting pathways or glial cell activation. Neurochemical changes like fewer opioid receptors also contribute. 3. Comorbidities and polypharmacy. Older individuals often have multiple health conditions and take many medications, which can complicate pain and its management. And 4. Psychosocial factors. Factors like anxiety, depression, social isolation, and a lower socioeconomic status are also linked to higher pain in older adults. Some older individuals may also underreport pain due to misconceptions or fear of pain. How to address misconceptions about aging? 1. Challenge ageist assumptions. Explicitly challenge the belief that pain is just part of getting old, both for health professionals and for patients. Emphasize that all new pain warrants assessment and, where appropriate, active management, irrespective of age. And 2. Differentiate normal aging from pathological pain. Educate patients on the common occurrence of age-related changes on imaging that are often asymptomatic. Reassure them that not every ache or stiff joint requires immediate, in-depth medical investigation unless red flag symptoms such as unexplained weight loss, new neurological deficits, fever, or severe trauma are present. The goal is to avoid over-medicalization and unnecessary diagnostic cascades. Let's put it in practice. Dr. Elena Rodriguez, family physician, is talking to Mateo, a 75-year-old man, who complains of new, mild, generalized aches and stiffness. He attributes it to just old age.
Mateo, you mentioned some new aches and stiffness. How long has this been going on?
A few weeks. Nothing too bad, just creaky. I suppose it's just old age, isn't it? My father always said you just get aches when you get older.
That's a common thought, Mateo, but pain is not an inevitable or normal part of aging. Many older people live active, pain-free lives. While our bodies show wear and tear inside, those changes don't automatically mean pain, and they often don't require extensive checks.
So, it doesn't mean something serious is wrong.
Not necessarily. For mild, generalized aches like yours, without warning signs, it's likely just common stiffness related to age or perhaps less activity. Scans often show wear and tear in people your age who have no pain. My main goal now is to help you feel better and stay active, not to find something broken. The best medicine for these aches is often movement and staying active.
Well, I don't want to just accept it. So, no x-rays needed for now.
Based on your symptoms and my examination, no, not right now. Your symptoms don't suggest anything serious that a scan would help us with. We'll focus on practical ways to improve your comfort and keep you moving. How does that plan sound?
That sounds much better than just living with it. I'm willing to try the movement.
To sum up, it's vital for healthcare professionals to combat against misconceptions about pain. By educating patients that pain isn't an inevitable part of aging and differentiating between normal age-related changes and serious pathology, clinicians can reduce unnecessary investigations and empower older adults to actively manage their pain, prioritize function, and maintain a high quality of life.